Hi, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions from our patients about veneers, so I'm here today to answer a few of the most common questions and hopefully give you a better understanding about what veneers are. So the first thing we get asked is, what are veneers? So a veneer essentially is a thin covering that goes over the front of your teeth in order to improve the appearance and form of the tooth. So when would a dentist recommend using veneers? So generally veneers are used when a patient is unhappy with the way that their teeth look. So if they're unhappy with the shade of them, or maybe they've been broken down, they've had some chips, or they've had some large fillings that they're not happy with the way that things look, then a veneer can be a great option to cover the front of that tooth and really improve the way that it looks. So patients will then ask, well, what is the difference between dental veneers and crowns? So a dental veneer simply goes on the front of the tooth. So it can usually be a lot more minimally invasive for the tooth. We just have to shave down a little bit of the front and then we glue that on. It's used more when we're making more smaller adjustments to the teeth rather than when a tooth is really broken down. A crown essentially covers the entire surface. So we have to shave a bit more down for the tooth, but we would use that in a situation when we're concerned about the overall strength and integrity of the tooth. The crown can help to improve that. So patients will then often ask, well, what is the process for getting veneers? So essentially to get veneers, it involves two main appointments. The first appointment is we're going to be preparing your teeth so that we can actually fit that veneer over top of it. So generally we're going to be giving you a little bit of numbing to freeze the area, usually for comfort around the gums. We're then going to remove a small portion of the tooth structure on the front of the tooth. And then we're going to take a digital scan that we're going to send to the lab for them to make your veneers. At the second appointment, we're then going to be bonding or placing those veneers on the teeth. So we're going to remove any temporaries that we have, we're going to clean up the teeth, and we're going to cement those veneers in place, and then you're going to have your veneers permanently cemented on the teeth. So will veneers and bonding cement match my tooth color? So yes, that's a very common thing that we're doing when we do veneers, is we want to improve the appearance of the teeth. So we're going to do everything we can in order to match those veneers to the color of the teeth. In cases that are more complex, what I like to do is actually send the patient right down to the lab so that the lab technician can do some shade matching and make sure those veneers look as good as possible. So another common question we get is, what are the differences between porcelain and composite veneers? So essentially the difference is the material that we're using to do the veneer. So a porcelain material is one that's made in a laboratory. The benefits of the porcelain are that because it's made in the laboratory, we usually can get a lot higher result in terms of the cosmetics. And then also that porcelain material is a lot stronger than our other option, the composite. So it tends to last longer. The composite is basically just our tooth colored filling material that we would use for fillings in the back teeth. We can do that to make veneers in the front. With that, we're making it directly in your mouth. So again, we'll do everything we can to make it look as good as possible, but we're not usually going to be able to achieve the same level of aesthetics as we can with those porcelain veneers. So patients will ask, well, what should I do now that I have veneers? What should I do to care for my dental veneers? So the main thing for caring for your dental veneers are like any other dental procedure. We want to make sure that we have really good oral hygiene. If we're removing the plaque and the bacteria around those veneers, you're going to be a lot less likely to get cavities, and cavities can form around these and then require us to replace them. So we want to avoid that. The other thing we want to avoid is just making sure that we're being careful when we're eating. So ideally not chewing into really hard foods, because that could lead to chipping or fracturing of the veneers and then needing for us to replace them. So another common question we get asked by patients is, how much do veneers cost? So again, it depends on which veneer option you're going with. Generally, the porcelain is going to be quite a bit more expensive than the composite one. As of 2025, general cost estimate for this is about $1,200 per porcelain veneer, and then you're looking at about $450 per composite veneer. So patients will then ask, well, are there financing options for getting veneers? And absolutely. So we do work with a financing company at our office. For a veneer case, like if we were doing, say, 4 front veneers, you could finance it for as little as $245 per month over 24 months. If you don't want to look into financing, we do also have a couple other options available in the clinic, and we certainly would be happy to go through that with you to make it as affordable as possible. So patients will also ask then, does dental insurance cover the cost of veneers? So unfortunately, with dental veneers, they are considered a cosmetic treatment, and therefore dental insurance will usually not cover the cost of that. But like I mentioned, a lot of the times patients will look into financing or other financial options, and we'd be happy to work with you to make it as affordable as possible. So patients will call and ask, how do I schedule a dental veneer appointment? So before we jump into doing the veneers, we would want to get you in for an exam. Part of that exam would be assessing your teeth for the veneers, as well as making sure everything else in your mouth is healthy, because we don't want to jump into veneers if there are a lot of cavities in the back. As I mentioned, you could then get cavities under the veneers, and that would not be a good thing. So we would do a thorough examination, go through everything that's happening in your mouth, and then come up with a game plan for doing your veneers as soon as possible. So I hope I was able to give you a bit more information about dental veneers and answer some of the questions that you have. If you are interested in dental veneers or just unhappy with the way that your teeth look, we'd be more than happy to meet with you to go over some of your options. If you'd like to do that, you can either email us or give us a call at 204-817-6768, and we'd be happy to help.